has dropped abruptly. What it indicates is that the most intense transmission was partially prevented by implementing the case isolation on board. However, the estimated reproduction number stayed around the value of 1 during the generation 6, 7, and 8. And at the latest time, still the reproduction number estimate was slightly above the value of 1. And we have counted the predicted number of infections. And in generation 9, according to mathematical model, there should have been a total of 384 infected individuals, of which 169 symptomatic cases must have arisen. And they are mostly represented by those who are already isolated because they tested PCR positive during the disembarkation procedure. And they must have been mostly isolated before illness onset. But according to the model, we have estimated that a total of 34 symptomatic cases would arise among those who have not disembarked. And of the 34 cases, 22 may arise from the close contacts, and the remaining 12 may arise from those who do not have a history of the close contacts, and those who tested negative during the disembarkation process. Yeah, basically that's what I have wanted to explain. Yeah, thank you very much.
Thank you, Professor Suzuki and Professor Nishiura. So these figures show isolation worked on the cruise ship. Mr. Kita, do you have something to add at this moment?
For this report from me, this is my apology for this materials is a bit old one. So we already publicly show the recent test report of on the cruise ship. So, but this is a long one. So if you are interested in that, we didn't finalize the translation yet, but I can distribute you the Japanese version. So my apology for that.
Thank you for the clarification. So now I would like to take questions from the floor. Please specify your name and affiliation before asking a question. Do you have questions? Yeah, maybe at the end of the row, please.
What happened in the cruise ship is under very big attention by the world community. So how will you deliver this kind of research results to the WHO or whatever the research organization or such kind of international formula can contribute to the further analysis of the development for overcoming for contributing to preventing the epidemic.
Sorry, I couldn't hear your first part of your question.
Sorry, I can use the microphone. So yeah, I'd like to know how you will deliver the outcome of the analysis of the the development of the infection in the cruise ship to contribute to the discussion to overcome the epidemic in the now as the case in the cruise ship is under very wide attention by the international community. So I'm sure that the research results will contribute to the further discussion in the international forum very much. So I have to your plan.
Okay, thank you very much. We have been collecting the data from inside the ship and also the quarantine office. And then, of course, we have been sharing the data through the Ministry of Health and Labor and Welfare to the WHO and also the other countries under the IHL. And apart from that, we already summarized these findings, and we already uploaded the reports on the National Institute of Infectious Disease website on February, I think, 18th midnight. So we already made our findings to the public, but the data is not completed yet. We still need to collect additional data, and also we have to clean the data. So we have to update our findings. And then we are now planning to update the reports very soon on the NID website. And also we are starting the collaboration with other researchers like Professor NISHIURA. And now we are preparing to publish the academic papers also soon. Do you have any additional comment?
Yeah. I'm actually from the university sector and I do not belong to the Ministry of Health, but the reason why we sacrificed the last 1 week technically overnight is to emphasize that we have a good capacity of infectious disease control and also the infectious disease research. The important mission that I received from the minister directly is to publish this finding as an original research article along with the National Institute of Infectious Disease people as early as possible, and the arrangement of the manuscript is underway.
So I would like to add one thing that we already have the discussion with the CDC and WHO, and that kind of discussion was also participated by professors. So I think the world is became a kind of skeptic about the Japanese control of the cruise ship. So we would like to explain our data analysis with these professors. So, and as Dr. NISHIURA said, that our minister would also like to have the discussion with the analytical data with the professors. And we would be very happy to share with the world.
Are there any other questions?
Please, sir.
Motoi with MBC News. I'm so sorry. I don't mean to bog everything down, but I still don't understand how you drive at these numbers. I mean, Mr. Suzuki, how did you drive these? How did you drive at these numbers that were reported as people having the infection before February 5th when the isolation started? How did you reach that conclusion? And also, Mr. NISHIURA, I don't understand how these numbers are derived still. And also, is this method something that's shared by the international community of scientists, or is this your own particular formula to come up with this calculation? Thank you very much.
Okay, so let me come back to the first figure. So this is showing the number of cases by date of onset. And again, the cruise ship arrived at the Yokohama port on February 3rd. And then quarantine officers, doctors screened the passengers and crew members. And then if they had symptoms, any symptoms, they collected swab samples from the patient. And then they also asked the patient if they had symptoms, when did their symptoms started. And for example, for the January 20th case, I'm not sure if they were tested on February 5th or 4th, but for example, if this patient develops so this patient who developed a symptom on February 20th, they were screened on probably February 3rd and tested positive, so that this case is reported as a case who developed the disease on January 20th.
Because that person shows symptoms on January 20th?
Yes, exactly.
Okay.
It's like that. Is it clear?
Yeah, now I
Okay. So maybe Dr. Nishima.
Yep. So I should perhaps firstly explain the principles of the calculation. Okay. So for instance, what the expected value in this figure at the generation 2 shows is the estimate is 0.5. Okay. And that's I should explain how it was calculated. So from 19th of January up until 22nd of January, there were 2 symptomatic cases as shown on the epidemic curve that Dr. Suzuki has just explained. And in the subsequent generation, there was only a single case who did not offer the date of illness onset, but we imputed the date of illness onset among those who turned out to be positive and those who have the date of testing result available. From date of illness onset up until the date of virus positive test result, there was a time lag of 3 days. And therefore, we back calculated the date of illness onset among cases who did not give us the exact date of illness onset. And so, in addition,
one person.
Yeah, yes, during that generation, and therefore, in addition to the epidemic curve figure shown in this slide, we added several cases whose illness onset date was unknown. And what we did as a calculation is one case generated by 2 previous cases, and therefore the calculation is 1/2, which is 0.5. So on average, a single infected individual produced 0.5 secondary cases. That's how the reproduction number was calculated, and approximately by grouping the number of cases by every 4 days, just by taking the sum of the number of cases during every 4 days, then we can regard the grouped sum as the number of cases in each generation. And what I did is just to take the ratio of the number of cases in every subsequent generation in a successive manner. And that is what it is translated as the estimate of the effective reproduction number.
But isn't the virus affect people differently? But doesn't the virus affect people differently? I mean, some people show it's more infectious for some people and not for some people. And if you're in a room of 2-person cabin and a 4-person cabin, the effects could be completely different, right?
Yes. Actually, I didn't explain it, but firstly, my direct answer to that question is that the reproduction number is the average number of secondary cases generated by a single pregnant case, and therefore there can be a variation. And regarding the variability of the transmissibility of the novel coronavirus, it's starting to be known that the variability is very high. Some of the cases majority of cases, let's say about 90% of cases do not generate any secondary cases at all, but only 10% out of all cases generates the secondary, substantial number of secondary cases, and taking the average, the result is in the community about the matter of 2. And that sort of variation is averaged here to see what happened in the population on the whole as an average. That's the principle of the reproduction number. And before estimating those values, we have also accounted for the different types of hosts, because transmission dynamics was dependent on the different types of individuals. And we accounted for 3 different types on the cruise ship. One is those who had a close contact among cabin mates. The other is the second one is the person who did not have any cabin mate infected, and the third is the crew members. As shown in the first epidemic curve, the crew members has got the recent infection increase, and therefore the accounting for those different heterogeneous patterns of transmission, we took the average in the end, and the average result shown in this figure represents the population average out of all different types of individuals on the whole.
And this calculation formula is something that's shared internationally, or is this your own study?
The formula of the generation-dependent reproduction number given by the ratio of the cases is a very standard one, which is even written in the textbook of mathematical epidemiology.
Thank you.